Styes are very common and they will come in a lot of different varieties of shapes, colors, and sizes. When an ophthalmologist, such as myself, looks at a stye, I'm typically looking at it to make sure that it is a stye specifically and not something more serious like an infection or an eyelid cancer. In general, styes are typically red or skin colored and they may appear as a bump on the eyelid or may make the entire eyelid swollen. They can occur on the upper lid, the lower lid, or they can occur on the front surface or on the back surface of the eyelid. As far as pain is concerned, most patients either have a dull ache or feel a little tender sensation by their eyelid, but some patients just don't feel anything. It usually comes on over the course of a few hours or days, and it can last anywhere from a few days to a few weeks to a few months and even up to a year actually. Typically, it shouldn't really affect your vision too much. You might notice that your vision is a little bit blurred if it's pushing on your eyeball or making your eye a little bit watery. For the most part, most of my patients are less than 40 years of age, but it could occur at any age, from young children to elderly adults. That being said, when we do look at these things, like I said before, we're looking to make sure that it's a stye specifically and not something like a skin cancer or infection, which would obviously need to be treated very differently.